About half of young adults will experience mental health challenges, which can affect thinking, feeling, and behaviour. Key stressors for mental disorders include societal influences, health problems, natural disasters, and personal circumstances. The treatment of mental ill health is frequently complex and costly, both for the patient and for health services. This can be due to the nature of the disorder and the high level of resources required. Mobile health technology offers a unique and innovative solution. Smartphone ownership is widespread. Text messaging is free for the receiver and requires little technical skill. Contemporary practice requires a robust empirical research base. This was rigorously undertaken for our supportive messaging programs. We used randomized, controlled studies and cross-sectional surveys to assess the efficacy of our supportive text messages. We conducted a randomized, controlled clinical trial in Dublin, Ireland. Participants with a diagnosis of major depressive disorder and alcohol use disorder were randomly selected to receive twice-daily supportive text messages for 3 months. The effect size for the intervention was large, with a statistically significant difference in the Beck's Depression Inventory Scale scores and a trend for a greater total number of days abstinent from alcohol in favour of the supportive text message group. A second randomised controlled clinical trial in Canada examined patients with major depressive disorder. They received twice-daily supportive text messages for 3 months. A statistically significant difference in key metrics was seen. Based on the encouraging results of these 2 trials, we developed the Text for Mood, Text for Support, Text for Hope, Text for PTSI, Text for Wellbeing, Text for Healthy Aging, More Good Days, and positive mental health programs, designed for broader populations who are struggling with mental health problems. Multiple language versions of some programs have also been developed. The Text for Mood and Text for Support program evaluations established that most participants felt the text messages made them more hopeful about managing issues in their lives, in charge of managing depression and anxiety, and allowed them to feel connected to a support system. Most felt Text for Mood and Text for Support improved their overall mental well-being. Participants in the Text for Hope evaluation self-reported significant improvements using the General Anxiety Disorder 7 scale, the Patient Health Questionnaire 9 scale, and Perceived Stress Scale 10. Participants were rated as having significantly lower risk of moderate to high stress, anxiety, depressive symptoms, suicidal thoughts, and disturbed sleep. Daily supportive text messages are a feasible and acceptable way of delivering psychological interventions to the public with mental health problems. Dr. Vincent Agyapong's Global Mental Health Research Group worked with partners to develop and evaluate this innovative tool to support people who have mental health problems. Resilience and Hope present an opportunity to help close the psychological treatment gap for those awaiting treatment or as additional support.